Okay, so Wendy, we are rapidly approaching time for open enrollment for the Affordable Care Act, right? Commonly known, everybody else knows it as Obamacare. What do people need to know? It's confusing. They come here to you, and I suspect it's not confusing anymore.
We try really hard to make it as easy as possible. There are a lot of things about it that have been confusing for people. One of the most confusing things is people don't understand that they cannot buy insurance whenever they want to anymore. Okay. They have to either have a special reason why they can buy insurance, or they have to wait for these open enrollment periods.
And when is it this year, the dates?
It starts on November the 15th. The last day to purchase insurance this year, well, it's February 15th of 2015. Okay. If they want a January 1st effective date for their insurance policy, they must come see us between November 15th and December 15th.
Okay, and you guys are so knowledgeable. I can only imagine sitting at home trying to work all this out. It's a nightmare. What kind of services are you going to offer to people coming in?
You know, we definitely recommend people come in. First of all, we want them to know it doesn't cost them anything different to come in and let us help them. We get paid by the insurance companies. The rates, though, whether they do it at home themselves or come in and let us help them, are the same. Okay. So it's really important that they understand it's not going to cost them anything to come in and talk to us. If they don't buy something, that's okay.
You're happy just to give advice to them?
Yep. They still don't have to, they don't have to pay us for advice. Right. So we're
the
thrilled.
visit is free?
Yep. Okay. Either way, whether they buy or not.
Who's going to be able to participate in this particular program?
That's a good question.
Are you glad I asked it?
Very much, very much. This is for all people who are not on the Medicare program, so 64 and under for the most part. We do run into some problems where people qualify for Medicaid or CHIP, and we can't help there. They have to go and apply through Workforce Services. But other than that, pretty much anybody ages 1 through 64, we can help out, as long as there's so many things about it that get complicated, right. But they might as well come in and have a conversation. If we can't help them, we'll point them in the right direction.
But you are totally happy for people just to come in and ask you the questions?
Yes, most definitely.
Okay. So what is going to be covered under the Affordable Care Act? What is going to be involved?
You know, it's been really beneficial for a lot of people. People are used to having to answer medical questions when they sign up for insurance. That's all gone away. They don't have to answer any medical questions any longer, and there's no pre-existing conditions.
So if somebody comes in off the street and says, I have not been able to get insurance anywhere else because I've got X, you're saying now that doesn't count anymore. You can't even ask the question.
Correct. As long as they pay their premiums, they can have the plan.
Great.
Yep.
Who else is going to qualify?
It's not really a qualification. Everybody qualifies. Anybody can qualify. One of the things, though, is that depending on your income, you may qualify for extra help. The government is helping people fund the premiums because they've become more expensive because they have to cover everybody and everything now. Right. So premiums have gone up. Depending on income and depending on a lot of things, will determine if the government will help you pay for your premiums and help you pay maybe even deductibles or help.
Really? So the help is out there, but people just have to know where to go and how to get it.
Exactly. Yep.
And you might be it.
We are it. We definitely enjoy helping people figure out what works best for them, explaining all of the options, educating them, and then allowing them to make a decision. We feel like it's important for people to be educated in what's going on.
And clearly that's not going to happen with people just sat at home ripping their hair out because they can't understand what's going on. So if you have any of these questions, come on in here.
Yes. Most people will start the process at home, and it's pretty easy, the beginning process. They can fill out the information. The problem happens when they get to the 65 some odd plan options and they start going, holy cow, I have no idea what would be best for me. Yeah. So we would recommend just coming in here from the get-go. Let us help you get through healthcare.gov. Let us help you get through the whole process. Don't start at home, just come in. We'll help you create a login if you need to, or whatever it is that you need help with. We'll walk you through the whole process from A to Z.
And again, a free visit.
Yes.
All visits free or just first one?
All visits are free.
So you get paid by the insurance company. I think that's important for people to know. They can come and see you for free.
Correct. And we do like to follow up afterwards if they have problems, they need a new member ID card, they're wondering if their provider is covered as an in-network provider, they can call us at any time and we will answer all of those questions and help them in the right direction. We help with claims issues. We help them call the insurance companies and take care of problems.
Wow, so really just a fantastic service being offered here at LSS. Tell us where you are and how they can get hold of you.
We are located at 169 East, 1600 North here in North Logan. Our phone number is 435-752-9493. And just for reference, our location, we're kind of squished in between the north wall of Walmart on the north end of town and the Sports Academy's parking lot. We're a white stucco building and we're the most west office in that building.
Okay, do people need an appointment or can they just show up?
They can do either. During this busy time of year, we get really busy, so we do suggest an appointment. Just call. There's plenty of people here who can help you schedule an appointment with one of the agents, but we do suggest phone calling. They can walk in, but they may get told that we have to schedule an appointment for later.
Okay, well, clearly a great place to come, and thanks a lot, Wendy.
Thank you.